angry patient, yeah. First of all, we need to know like how a patient can show anger, because anger is not something like shouting all the time, isn't it? Sometimes you can show anger by shouting, but there can be other ways of showing anger as well. Okay. And I personally say if your patient is shouting, you got an angry patient who is shouting, in my opinion, I would say it is an easy patient to manage. Okay, why? Because somebody is shouting, somebody is telling how they are feeling. Then there is a solution if you got to know the problem. But on the other hand, listen to me, if on the other hand, if you got a patient who is not talking at all, who is just being annoyed because of the treatment he got in the hospital and he's not telling you anything, I mean, he's giving you a silent treatment. Do you think that patient is difficult to manage? Right. I mean, just take it. I mean, if you are, for example, it's a funny example, but I really want to give it here. For example, you're married and tell me honestly, in the chat box. For example, if you're having any, say, a bit of fighting with your better half. So what do you think? If they're shouting at you, would that be okay? Or if they give you silent treatment, what do you think, which is difficult for you to manage? Tell me in the chat box. Shout out. So that's easy. Talking is better. Okay. Oh, I'm sorry, my friend, you are singing. Silent is slow killing. Silent is worse. Yeah, yes. Silence is hell. True. That's what I want you to understand, that in the exam, if the patient is shouting, it is easy patient to manage. Because, okay, answer my another question. If they are shouting, what do you think for how long they can shout? If a person in the exam is shouting, you know the station is of 8 minutes. If they're shouting, for how long they can shout in the exam? 3 minutes. Maybe 30 seconds, a minute, 2 minutes. Okay. That's fine. Uh, that's true. I mean, so now if somebody says, yeah, they can shout for the whole 10 minutes, whole 8 minutes, it's not possible, guys, because, you know, they have to have like, say, 36 candidates in a day, isn't it? And shouting for 8 minutes won't be easy for them. Moreover, they can shout, I agree, they can shout for 8 whole minutes as well if you help them. If you poke them, they'll shout for 8 minutes. If you try to justify the mistake, they will shout for 8 minutes. But if you do not interrupt them, if they're shouting, let them shout, let them vent out. They won't shout for more than a minute or two. That is it, right? Now, okay, so few things I'll mention it here. Number one, what we have mentioned is voice control. So make sure you have got, you're soft spoken. I mean, just a sec, guys. I think on the other tab, just a sec. Sorry. Yeah, now it should be okay. All right. Yeah. So, voice control, because what I want you to do is you have to be very much soft spoken, right? I mean, to be honest, I feel females have got this inherent thing that they are soft spoken, but many of male candidates, when I meet them, so they're not very well, like they're not very much soft spoken. So you need to work on that. So the first thing is voice control. Make sure you are soft spoken and you are giving proper eye contact as well to your patient. That's really important. Nodding, what I mean by nodding, you know, this is an expression that you need to show it to your patient that I'm listening to you. For example, if your patient is talking, your patient is shouting, for example, or talking continuously, maybe for 2 minutes or so. So you cannot interrupt them in the exam, that's for sure, but you need to show them somehow that I'm listening to you. I'm not relaxing, I'm not sleeping, I'm listening to you. So what are the things that you can do? So you can nod. Maybe you can say, okay, So these are the active signs of listening. Okay. And then keep distance. What I mean by this keep distance. So In the exam, okay, first of all, how you can show anger? We said like there can be loud speech, there can be verbal abuse as well, there can be aggressive posture as well. So these are the ways you will see the patient can show their anger. Obviously, in real life, you can have physical abuse as well. Maybe patient is just lifting the chair and just hit on you. That can happen in real life, obviously. So in real life, what we do whenever we feel threatened, whenever we feel like he's gonna hit me, what we do is we leave the room then and there, right? So that's what happened. But in the exam, obviously, physical abuse is not going to happen, isn't it? But verbal abuse, loud speech, aggressive posture, all these things are going to happen. So if you get aggressive posture, for example, this is you who is sitting and this is your patient. So aggressive posture means what I mean by that, patient is shouting and coming close to you. You know, when they're shouting and coming close to you, you will feel under pressure. You will feel under pressure. So what you need to do, you need to go a bit back on your seat, maintaining the same distance. So this is what you need to do. I mean, it's a subtle change in your posture, but that's going to help you out a lot. An examiner is looking for these things. Are you making these subtle postures or not? Subtle changes in your posture. All right. On the other hand, I mean, if you see a patient who's embarrassed, who's not talking to you at all, so what you need to do, what you need to try, you need to go a bit close to the patient. So that is really, really important in terms of your posture. You need to be very careful with that. Okay. So that's what I mean by keep distance. So take care of these points, voice control, eye contact, nodding, keep proper distance. And you may see angry patient who is having loud speech, verbal abuse, and aggressive posture, and you know how to manage them. Okay. Now, first thing, acknowledge their anger. That's what you need to do. Acknowledge their anger. Do not, never tell the patient to calm down. That's the common mistake that I've seen a lot of candidates we do. What we say, patient is shouting and you get overwhelmed with that. And what you say, calm down, calm down, calm down, have a seat, calm down. Never say calm down to your patient. The thing is, calm down. If I have to calm down as a patient, I'll calm down. You are no one to tell me, isn't it? What you need to do in the exam, you need to acknowledge what you see, say it. As simple as that. What do you see? What do you see? I'm angry. Just say that. I can see you are angry. I can see you are upset. You are looking very upset by all these things. What has happened to you? Just mention that. Keep it simple. Acknowledge, acknowledge, and more acknowledgement. That is what you need to do. All right. Understood. Okay, so after acknowledgement, the thing is, and you know, spend some time when you do acknowledgement. I've seen most of us, we do not give much importance to the acknowledgement lines. We're like, I can see you're angry, tell me more about it. Come on, give more importance to your acknowledgement. I can see you are angry, I can see you are upset, this is, I really want to help you out, but I really want to understand what exactly is happening. This is the first time I'm seeing you, so I need to ask you a few more questions to get the better understanding what has been happening with you, right? So that is something, say a bit more. You need to make your platform, then only you can start the station. But I've seen like many of us, we just want to start the station, want to ask so many questions from the first second itself. No, first minute is to build the rapport. You need to build the rapport. You need to make that friendship and all. And once you build that rapport, to be honest, patient will tell you everything. In the end, they'll be your friend, not your enemy, or they won't be angry anymore. Okay. So acknowledge, acknowledge, acknowledge. Never say calm down. And what you're gonna do is acknowledgement of their anger. Now, before you jump into it, why they're angry, try solving it. I would like you to take a bit of history for patient safety. What I mean by this word patient safety. And to be honest, I have kept this line patient safety in most of my slides in ethical scenarios. Assess the patient's current condition. So this is what I want you to do, because what is my first priority? What is my first priority? My first priority is my patient's health. So patient is angry, he's a patient. Obviously, there is some problem. He's maybe a heart patient, he's maybe a chest patient, maybe some abdominal problem he has got. So what I want you to do before you jump properly into the station, that is gonna be that ask him, how are you now? Do you have any pain now? Do you have any shortness of breath now? How's your diarrhea now? How's your constipation now? So I'm not saying go in very much of detailing here. Just ask a couple of questions so that what's going to happen, you are actually thinking about your patient per se. So that's what you need to do, right? So patient safety, asking a couple of questions for the betterment, for the well-being of your patient, right? And many times you will see like angry patient, for example, you entered into the room, Sometimes they are sitting. So you go and sit on your chair and you start the conversation. But many a times what can happen is when you enter into the room, what you saw, the patient is actually standing. Okay. So can you talk to them in standing position? Can you finish the station in standing position? Not really. That won't be a good idea. Right. So what you need to do, you need to make them sit first. And sometimes, they won't give you time to introduce yourself as well. What I mean by that, you entered into the room, you are ready with your lines. Hello, I'm Anka, one of the doctors. And may I confirm your name and age, please? You're ready with those lines, right? But they won't let you introduce yourself as well. What they will say, you are starting hello, and they're like, how can you treat my son like that? I mean, this is not something I was expecting from you. I was expecting better treatment in the hospital. I mean, they just started venting, and you didn't get time to introduce yourself as well. So now, when they have showed the anger for a minute, they have shouted for a minute. Now it's your turn to talk. I've seen a lot of candidates, they start like, hello, I'm Ankur, one of the doctors. May I confirm your name and age, please? No, they have asked you something, they are angry. So what you do first is, I can see you are angry. I can see you are really upset. And I'm here to help you out. I'm here to answer all your queries. First of all, if you can have a seat, then we can have a conversation. Make them sit, you will sit. By the way, I'm Ankur, one of the doctors. May I confirm your name and age, please? So that is how you need to start the conversation. Okay. So first thing is acknowledgement, and then I would like you to take a bit of history as well for the betterment, for the well-being of the patient. Okay. Then try finding it out why they are angry. What is the reason of their anger? That is really important, isn't it? Because then only you can solve it. So tell me more, why are you feeling this way? And try to offer a solution if that is possible. For example, I'll give you a couple of examples here. We have a scenario, my patient is angry. The reason is her cannula was blocked. My patient cannula was blocked and nobody changed the cannula on time and didn't give her antibiotics on time. And that's the reason my patient is angry. Of course, the patient has got the right to be angry. So there is a problem, and you found out why the patient is angry because the cannula is blocked. Now tell me, what is the solution that you can have for this patient? I mean, I think is a very simple solution is change the cannula, right? Who changes the cannula? Now don't say, I'll tell my staff they'll come and change the cannula. No, it's your duty. It's done by doctors. Changing the cannula, doing blood sampling, all these things are done by the doctors. So patient is angry. The reason is nobody changed the cannula. So what will be your plan there? I will change your cannula now. I'll give you fluids now. I'll give you antibiotics now. So if you actually give them the genuine solution then and there, you will see they will automatically calm down a bit. So this is something that you need to do. So acknowledge their anger, take a bit of history, patient safety, try finding it out why they are angry. And once you found out why they're angry, you try to solve it. What else you need to do? You need to apologize. That is really important. Apology is very, very, very important. Say sorry to the patient. Now you need to be very careful, guys. You know what advanced communication says? What advanced communication means in terms of these cases and all. Never say sorry, never say thank you only to anybody. That's not good. What you should say, I'm really sorry for this. Thank you for this. Thank you for listening to my webinar. That is what I should say. Instead of saying thank you only, thank you for doing this. So this is what you need to do. That is what advanced communication says. So whenever you are saying sorry, you need to tell them why are you saying sorry. I mean, so don't say sorry like I'm sorry. I'm sorry you are in this situation. I'm sorry you are feeling this way, because you will get so many patients who are angry without any reason. So there is no point of saying, I'm sorry on behalf of my colleague, I'm sorry on behalf of this. It doesn't make sense. Patients are spoiled, do not spoil them even more. So whenever, most of the time, whenever you have to say sorry, say in this way, I'm sorry you are in this situation. I'm sorry you are feeling this way. Sometimes it's not our fault, but they're angry. I need to say sorry. Sorry because you are feeling this way. I'm sorry you are in this situation. Obviously, when we are at fault, when there is a medical error, when there is a mistake, and you want to say sorry on behalf of the team as well, that's absolutely okay. But in some cases, it may not make sense. So you need to be extra careful on that. I'm sorry you're feeling this way. I'm sorry you are in this situation. Okay. So, yes, acknowledge patient safety, find out why they're angry, try to solve that reason, apology, and you need to know why you're saying apology, why you're saying sorry. Okay. And incident form. Let's talk a bit about this incident form, what I mean by this incident form. So it is incident form. Some says it is an adverse report form. Some in the hospital, we use the word DATIX as well. Same thing, but yeah, different names you can have. So, incident form, number one, it is not at all related to the complaint. It's not like I want to make the complaint and that is why I'm filling incident form. No. Incident form we fill so that any incident which has happened, we can prevent it from happening in the future. It is our own assessment, it is our own improvement. It is not at all related to the complaint. How to make the complaint, I'll tell you in detail. But incident form is just for our own improvement so that we can prevent these kinds of incidents happening again in the future. You'll be filling the incident form when there is a mistake, when there is an incident and you know there is something that we can do to improve it. Then only we fill the incident form. I'll give you an example. Okay. Uh, for example, you got a patient is a 50 years of age, 50 years of age patient, and he came to the A&E because of chest pain. Chest pain was very typical. It was going to the arm and to the jaw. So this kind of chest pain you got, right? And the doctors in the A&E, they did some investigations. And I know, you know which investigations we did. We did ECG, we did troponin. So these two tests definitely will be done. And when the report of ECG came, the doctor in the A&E wasn't very comfortable reading the ECG and he thought it's normal and didn't wait for the troponin to come back and send the patient home by giving some stronger painkillers. And with those painkillers, for the time being, patient was feeling okay. All right, done. Now what happened is obviously the patient came after a few hours, maybe after a day, patient came back to the hospital again because obviously the painkillers were not helping, right? And when he came the next time, the doctors, obviously the doctor was different that time and they did the investigations again. They did check the investigations which were done previously and the ECG was showing typical changes of MI and the troponin was very high as well. So what we did, we admitted the patient, we managed the patient and patient is doing okay now, right? But what has happened? A mistake has happened. So now what happens is in a lot of countries, we don't even tell the patient that we made a mistake while treating you in the hospital, isn't it? But here, I would say, we are honest, we are open, we are transparent doctors, and we do not hide anything from our patient. And that's why I'm telling it to you that while treating you in the hospital, this is what has happened. So you need to mention it to the patient, right? And then what we tell the patient that we are going to fill the incident form so that we can prevent these kinds of incidents happening again in the future. I said incident form is not a complaint. So what we're going to achieve by filling an incident form? So what happened is when we fill the incident form, what's going to happen? So we will see why this has happened and we try to implement something so that it can be prevented. For example, ECG was not read properly by the colleague, the junior colleague in the A&E. So what we can have? We can have more teaching sessions for the ECG for the junior colleagues in the A&E. That will be very helpful. We will give them the education that if you're not sure what is there in the ECG before you send the patient home, what you should do, get it checked by the seniors. Another learning lesson that I've got is I should not be sending the patient home who is coming to me with the chest pain without checking the troponin. So that is my learning lessons. So this is what you need to do, right? And that is the aim why we fill the incident form. Again, I'm saying it is not a complaint. It is not a complaint. It's our own improvement. We do it, we fill it so that we can prevent these kinds of incidents happening again in the future and we can give best possible care to our patient in the hospital, in the NHS. And that is the main aim, right? Another thing is this incident form, it is a confidential document. It is a confidential document and we won't be sharing the copy with the patient. If they ask you to have a copy, you need to deny it. You need to say, sorry that I'm not able to give you a copy for it, right? So this is really, really important, right? And yeah, so this is very, very important that it is a confidential document. And you know, anything happening in your ward, in your hospital, it is always good to involve your seniors as well. Mention that I'm gonna involve my seniors as well. I'm gonna keep them in the loop as well. Many a times, patient they are Like, I want to talk to your senior. That's fine. I can see you want to talk to my senior, and which is absolutely fine. So what I'll do, I will book an appointment with my senior so you can have a chat with them as well. And for now, you just talk to this patient and try whatever you can do in your best of your abilities. Okay. Few things here for the medical error. I'll come back to this slide again. So what happened whenever we have got a medical error? How do we approach patient safety? That is the main thing. So asking a bit of question about the patient safety in the beginning. Documentation, we always document the incident in the patient's record. We document it in the patient record, but we never share the copy of incident form with our patient. Being open, yes, we are very open, inform the patient and their family and the carers and apologize, right? Mainly with the patient, but with the patient consent, obviously we can speak to the family members as well, all right? And we apologize for what has happened. Okay, reporting, we do report it, reporting the incident by the local reporting system by filling an incident form. Understood. Learning, how will my report inform the local and national learning? And the thing is, whenever we report these incidents and whenever any solution comes, it is not only for this hospital, it is actually national wide, all the hospital across the NHS. So that is the importance of filling an incident form. And obviously, if patient wants to make the complaint, they can make the complaint as well. Let's talk a bit more about these complaint procedures and all. So, what did we understand till now is acknowledge their anger, patient safety. Take a bit of history so that you know patient is fine at the moment. All right. Find out why they're angry and try to solve it then and there. That's the main thing here. Apology. Sorry. I'm sorry you're feeling this way. I'm sorry you are in this situation. And mention about the incident form. If there is a medical error, if there is a mistake, then I'm going to fill the incident form so that we can prevent it from happening again in the future. But if they ask you a copy, you say no because it's a confidential document and we cannot provide you with a copy of it. All right. Now, if your patient says, I want to make the complaint, I want to make the complaint. So how to make the complaint? Let's talk a bit about it. So complaints. So there are two ways you can make the complaint. So we have got the complaints in the hospital and we have got the complaint in the GP surgery. All right, so there are two different ways that you need to guide the patient. I mean, if they want to make the complaint in the hospital or in the GP surgery. So in the hospital, what happens is we have got an office which say PALS, right? And in the exam, I would like you to break it down for the patient. So it is patient advisory and liaison service. So it's an office where patient can go and make the complaint. All right. So if patient says, I would like to make the complaint. So what you will say that, okay, yes, it is your right. If you want to make the complaint, it's your right. So we have got an office, which is Patient Advisory and Liaison Service, PALS. So I will guide you there and you can make the formal complaint if you feel that your treatment was not done properly. All right, I can give you the leaflets as well for PALS, so you can go and make the formal complaint, right? So this is how it works. Remember one thing, guys, and I know you will get lots of conflicting answers from different people. I would like to uh, solve your conflict. Remember, you never encourage the patient to make the complaint. You never encourage the patient to make the complaint. But if patient says, I want to make the complaint, you have to guide the patient. I mean, you're talking to the patient and you're not, patient never mentioned, I want to make the complaint. Situation is going well and you're like, you're not happy, go and make the complaint. Never do that. You will never encourage the patient to make the complaint. Right? Remember this. If patient wants to make the complaint, you will guide them. But if they don't want to make the complaint, you will never encourage them to make the complaint. I mean, it's simply like, why should I hit my head in the wall? I won't do that, isn't it? So I will not encourage my patient. But if my patient says, no, I have to make the complaint, fine, it's your right. I'll guide you how to make the complaint. I can guide you to PALS, Patient Advisory and Liaison Service. Understood. Now in GP surgery, what happens is we do not have PALs here. What we have is we have got GP practice managers. right? So in one GP surgery, uh, we can have so many GPs. It's not like one GP surgery, there are only one or two GPs they're working. There are so many GPs who are working in the GP surgery. Can be five, can be 10. And there are a lot of GPs, they might be coming for a day or two for locum as well, isn't it? So, but there are GP practice managers as well. So if you want to make the complaint for the GP in the surgery, in the GP clinic, in the GP surgery, so what they say is you can make a written complaint. You can make a written complaint to the GP practice manager. So you make a written complaint to the GP practice manager. Written means written, or it can be via email as well, because that is written as well. Okay. So make a written complaint to GP practice manager. Then what they will do, they will acknowledge your complaint. They will acknowledge your complaint, and then they will work on it, because they will see which patient, I mean, this patient was seen by which GP, why this investigation was done, why this was not done, what was the reason. So they need some time to work on it, isn't it? So they acknowledge like, okay, I've got your complaint, we are working on it, right? And then we will definitely, the GP practice manager, they talk to the concerned GP about this and that. And then what happens is a proper explanation is made. A proper explanation is made, and then we send this draft to our patient. If patient is satisfied with the explanation, it's okay. If not, they can take you to the next level. They can drag you to the legal areas. They can drag you to the court as well. So make sure you are ready with your indemnity insurances as well, right? So this is how it works. So in the GP, you make a written complaint to GP practice manager. It's going to be written complaint, or it can be via email as well. The GP practice manager, they'll acknowledge your complaint, and they will come back with the explanation in a few days' time. If you're satisfied with the explanation, that's okay. If you're not satisfied, you can actually make the complaint in the tribunal. You can make the complaint to the court as well. All right. So this is how it works. Okay. And again, guys, please do not encourage the patient to make the complaint. Okay. Now, another thing, tell me, if, for example, while treating the patient, we made a mistake. Now, what is the best thing that you can do? What is the best thing that you can do? The best thing is accept your mistake. That's the best thing that you can do. I know what has happened was quite unfortunate. It is our mistake. I know it shouldn't have happened. I'm really sorry for what has happened, and I'm glad to know that you're fine now. Right? So accept your mistake. Accepting the mistake is the best thing you can do when you are talking to an angry patient. If there is a mistake that you have done, obviously, that's what I'm saying, right? What is the worst thing that you can do? And why a patient is shouting to me for 8 minutes? What's the reason? Because you are trying to give excuses. For example, you missed an ECG, and you didn't wait for the troponin, and you send the patient home. Now, I mean, you missed the MI, and now you're trying to justify why I missed. I missed because the treating doctor on that day in the A&E was a junior doctor. Come on, I mean, as a patient, am I interested in knowing these kind of excuses? I mean, what is going to be the patient response if you say these things? Oh, the treating doctor was junior doctor, that's why I missed ECG. It's none of my concern, isn't it, as a patient? So please do not give excuses. Yeah, I miss your ECG because we are having shortage of staff. Do you think patient is going to take that shit? Not at all. So please make sure you do not give any excuses. If you give excuses, you're just making the things worse. You will never be able to come back in the station. You failed the station already. So we need to be very careful in that thing. Okay. So please make sure you never give the excuses like we were having shortage of staff, we are like junior doctor was treating you. Then they will be like, why junior doctor was treating me? Am I not the important patient? Am I not paying taxes here? Why? I mean, shortage of staff. So is it my problem? So shortage of staff. So you're treating other patients. Why did you miss my ECG? Am I not important here? So you're gonna make the things worse. So you have to be very careful. Okay, so these are the things that you need to do, and this slide is going to be very helpful in managing a patient who's angry, whether it's a medical error or patient is angry maybe without any reason. So what you do, acknowledge their anger, and You talk about the patient safety, taking a bit of history, finding out why they're angry, try to solve it then and there, and check if you need to fill the incident form, right? If you need to fill the incident form, fill it. It's a confidential document. You won't be sharing a copy with the patient. All right. And sorry, sorry, sorry. That's really important. Apology is the most important thing in these kind of station. And a lot of candidates say, oh, I said sorry once and they were not happy. Come on, once, if you've said, you can say twice and three times as well. It's not a big deal. In this country, sorry, please, kindly, thank you. They are free of cost, isn't it? And if the patient wants to make the complaint, you can guide them to PALS as well. You can guide them to PALS as well in the hospital. But if it is in the GP, they want to make the complaint, you can make the complaint to GP surgery. They can make the complaint to GP practice manager. They can make a written complaint, and then their complaint will be acknowledged, and a proper explanation will be sent to them. If they're satisfied, okay. If they're not satisfied, then they can drag you to the court as well. All right. And make sure we do not give any excuses in these scenarios. All right. Another thing, okay, let me give another example. Okay, so we have a patient. Uh, we did a hernia surgery for that patient. And after hernia surgery, as it was a daycare surgery, we sent the patient home. Patient went home, and after a week or 10 days, patient came back because patient has an infection at the hernial site. So patient is angry because he got infection. He's angry. He's shouting, "Why can I mean, how can I get this infection? Maybe you didn't treat me well." So in this position, in this situation, are you gonna fill the incident form? Tell me, are you gonna fill the incident form when patient has come to you because patient got infection at the hernial site? Are we gonna fill the incident form? The answer is we are not going to fill the incident form because it's not a mistake. I mean, incident, it's the thing is, infection after the surgery is a non-complication. And we always tell our patient before we do the surgery, like these are the possible non-complications of the surgery. It can happen with anybody, right? It may happen to you, it may not happen to other person. It depends. I mean, that is a part and parcel of the medical science, isn't it? So in this case, you do not need to mention about the incident form. So you need to be very, very careful. Where are you mentioning it? Where you do not have to mention. So you need to play very well in the scenarios. All right. And yeah, so that is it. That's what I have got.